So Kieran, what are the common issues around lameness that you would experience in practice?
I suppose we wouldn't get culled, as much to individual sheep anymore. It's generally a flock problem. So you might have an outbreak of scald in lambs or foot rot in ewes, and we'd be called out to that. Increasingly now we see more cases of cod, particularly in the autumn after breeding sales and store lamb sales. Generally it's a flock problem now that we're involved in. Maybe when someone has been tackling the problem for a while themselves and maybe it's continuing to spread, it's getting a bit out of hand, they give us a call. And we go out then and try to just investigate. I suppose the most important thing to do is try to establish what's the cause, what's there, what's causing the problem. So in lambs it might be scald, but at this time of the year you might have bought in breeding ewes at a sale and maybe didn't quarantine them, they went out with your own flock and now you have more lame sheep than you usually do, and you thought it was foot rot, but as you go and investigate or you get the vet involved, it's not responding to treatment and maybe it's cod, and that's a much more difficult condition now to eradicate from the flock.
So a key message is to try and establish a diagnosis and get your vet involved.
That's the most important thing, yeah. Try to find out exactly what it is you're treating. Most farmers will know. A few lame lambs, it's probably scald. You'll treat that, you'll get it right. But in a lot of cases, it's generally a problem you've brought in if it's a new problem that's spreading through the flock, and you need to investigate that and find out what it is. And just get your vet involved, and the more involved you are with them, the better, I suppose. You can develop a flock health plan specific to your farm.
The 5-point plan is a very useful tool to tackling lameness in flocks, and it can be beneficial for flocks that already have quite a low level of lameness to maintain that level of lameness at a low level within the flock, but also for flocks that have a high prevalence of lameness. It can be a really useful strategy to actually lower the amount of lameness within that flock. There are 5 parts to the 5-point plan: treatment, cull, quarantine, avoid and vaccination. So Kieran, in terms of treatment, what is your advice usually to farmers around treatment for foot rot?
For foot rot, I suppose we would encourage the use of a long-acting antibiotic and an anti-inflammatory. Your own vet will recommend the antibiotic based on a flock health plan that they'll probably draw up with you. But we would also recommend the use of an anti-inflammatory. It's a very painful condition, and certainly when you give an anti-inflammatory, these conditions tend to improve an awful lot faster. It's very important though that whenever you go to treat these sheep, that you identify them, that you mark them, you record their number and you isolate them from the flock. So that you're trying to prevent spread throughout the flock, but also knowing this sheep, if she's a sheep that needs to be treated again in the future, she possibly might need marked and culled and taken out.
And I suppose that leads us on nicely then to culling, a strategy that's implemented here by Richard on his farm. It really does help to reduce the overall infectious pressure within the flock.
Yeah, so Richard did have an issue here a few years ago, and he implemented the 5-point plan. That's I suppose the gold standard in treating lameness. He's really reduced the level of lameness he has in the flock now, and part of that is culling. So if he identifies an animal today that he's treating for foot rot, that animal is isolated, it's treated accordingly. If he has to treat that ewe 3 times this year, she's gone, she won't be retained for breeding again, nor will her daughters.
And it leads us on nicely then to the importance of good records, and as well as that, isolating out any affected ewes. So ewes that are actually affected by foot rot, removing them from the main flock.
That's exactly it. You'll see if a ewe has foot rot and is lame, invariably if she's twin lambs under her, one of those or both of those lambs will be lame as well. It is that infectious, and they're covering the same ground as their mother, so they're getting infected as well. So it's really important to try to stop the spread in the flock, that you take these animals that require treatment out, separate them. But it also means it's easier to record and know where they are and continue a course of treatment and get them back.
And then as well as that, if you're purchasing in animals, Kieran, it's important then for quarantining new animals that are coming into the flock and have those checked to make sure there's no issues.
That's exactly it. Now, you're going to check them, I suppose, when you go to buy them in the first place. And this is so important, I suppose, for sheep farmers from any diseases now. So you really should develop a flock health plan with your vet, and the quarantine period is really an essential part of that. You don't want to bring any infectious disease, whether it's a different strain of foot rot or a different strain of cod, onto your farm. You don't want to bring any infectious disease really. So it's important to isolate these sheep as soon as they come.
It also gives the farmer a chance during that time to give Heptivac P to the rest of the flock, and I suppose that brings us on then to actually vaccinating with FitVax. What's your key message around vaccination?
So vaccination is an integral part of the 5-point plan. Now, it's not a silver bullet, but it's very important in that it lowers the incidence, it increases the immunity against foot rot, and lowering that incidence overall will help you manage lameness better.
And then the final part of the 5-point plan is avoid. And we know sheep tend to follow the leader, so where one walks, the second one and the third one, they all seem to place their feet in the same place. Is there anything farmers can do to try and reduce the amount of infection around, say, like feeding troughs and walkways?
Well, look, I suppose the best thing they can do is try to rotate troughs around if they can. But I think as grassland management improves, what's really happening now is as farmers try to manage grass better and paddock graze better, they're moving sheep more regularly. So you don't get that constant build-up of sheep in one area, and that does help. Where sheep are fed concentrates in the spring or something like that, or lambs are creep fed later on in the year, if they're coming to the same area and you get a lot of poaching, you are going to get a lot of spread of scald and foot rot from the area.
So an important strategy to implement the whole 5-point plan as a tool to reduce the amount of lameness, and we can see the benefits of that here on Richard's farm.
It really is important, and it's important to make that, I suppose, a part of your overall sheep flock health plan.